Hi everyone, Joanne here. I've decided to do a video for you on a percutaneous catheter. It can be inserted in a patient for a variety of reasons and for a variety of locations. And it'll be your responsibility to understand why your patient has a specific catheter that they have and the care that's associated with it. But we don't actually teach this in lab, so I thought this would be helpful. It is quite common in clinical practice. So there's a few little differences to it. As far as the sterile technique goes, that's the same. But I just want to walk through the pieces and parts of the percutaneous drainage catheter so that you just have a little better understanding when you're in clinical. So I'm going to follow the Health PEI Policy and Procedures manual for this. Please be aware that if you are in a different province or in a different institution that you would be required to follow their policy and procedure, but I'm going to use it for a reference. So my patient here has a percutaneous catheter kind of in his flank area, and it's 7 days. So the dressing is now due to be changed. It's 7 days old, and that's typically when it's changed or if there is any drainage or any lifting of the dressing underneath. But before we change the dressing, I want to walk you through some pieces and parts of equipment that I would have needed to gather before I started. Well, obviously I don't need to gather this. This is a pigtail because it's already inserted in the patient, but it's a good opportunity for you to see it. I call it a pigtail, others call it a pigtail, some call it a percutaneous drain. There's lots of things that we may call this. But basically it gets inserted for whatever reason that the patient has that they require the drain, and it gets inserted usually in ultrasound guided areas where they can actually see the area that they want to place this in perfectly. And it's put in with kind of like I'm going to say it's like a knitting needle. It's like a hard device that actually gets inserted into the catheter that will actually hold this out more straight so that whenever it goes in, it can go into the location that it wants to be in. When the hard device that keeps this straight gets pulled out, it coils backwards, and there's a little cord here that I can use to pull it in tighter, and it coils sort of like a pig's tail, okay? So that's basically what holds it in. That's basically what's holding it in here is this bit of a coil, okay? So this is the pigtail here, and I just wanted you to see what it looks like. It's typically not sutured in, so you need to be careful when you're dealing with it. In order for it not to get tugged, we're going to use a stat lock device. Now this is not the same stat lock device that we use for catheters. This is a different one, and there are different sizes. So the pigtail that is in my patient right now is a 10-12. So my stat lock up in the corner, universal 10-12. So it matches. Your pigtail and your stat lock, they actually have to match, okay? But it is not the same stat lock as a catheter. I'm going to use a face mask on myself and on the patient. If the patient is unable to wear the face mask, they are to turn their head away from the location. I'm going to use blue gloves to remove, same as I would on any dressing, and I'm going to use sterile gloves when I get operating and kind of getting down deeper into the dressing change. So I'm going to gather up and set up my supplies and we'll get started. Okay, as you can see, I've draped my patient with my sterile drape here. I'm wearing blue gloves, so I'm just going to now carefully remove this dressing. So remember, when I take the dressing off, and just be careful, this is not the correct dressing, but this was the only one I could find that would work. Whenever you take it off, just be careful that you're not going to dislodge, and just kind of come towards the site of the insertion and then just carefully remove your dressing. It is held in by a stat lock. It should be okay, but I just don't want any pull or any tension from the actual insertion site, okay? So the stat lock, the dressing is just like a big Band-Aid over top. I'm going to remove that, and now I'm going to get rid of the stat lock. So I'm going to pinch it, very similar to the catheter one, but I'm going to pinch it to release, and then I'm going to take the catheter out. Okay? And I'm just going to set the catheter. I'm kind of using the towel to help hold where I want that catheter so I can see it. And if you just rub with your finger, you at least get something to half hang on to. Believe me, this sticks fairly well on most people, so you just want to make sure that you don't cause any skin tears when you're removing it, so be extra careful. So the stat lock has now been removed. I'm going to get rid of my blue gloves, And because this is a sterile dressing, I have set up my sterile tray. I've opened my sterile tray. I've added all the supplies that I need to add, and I'm now going to put on sterile gloves. Got my sterile gloves on, and I'm just going to walk this over where you can sort of see it a little bit better. So after I took the dressing off, I opened up my sterile field, I added my sterile saline, but I left all the utensils on the inside because it's a sterile dressing, so I cannot put them on the edge because they become contaminated. So I've added my supplies. So my saline is in there. I've added my supplies. I'm good to go. I then added my sterile gloves. So this is the point that I'm at. Here is my StatLock device, and here is a skin protectant pad. All my utensils are in the inside because I'm wearing sterile gloves, so I can certainly move them and put them anywhere as I need to right now, but I cannot put them in the 1-inch border, so I'm just going to keep them kind of on the side of my tray. What I want to do is clean the insertion site, and I want to clean kind of from the site outwards. So I'm going to go at the site and clean around and just kind of, you know, the size of a tennis ball or so, and move my way out. And I'm going to clean with sterile saline. So I'll gather up a little ball of gauze here, start at the insertion site, and just work my way around. And whenever I lift the gauze, then the gauze becomes garbage. So you can't like keep lifting the gauze and setting it down. You just want to kind of set it and lift it once, and when you lift it, then consider it dirty. Okay, so I'm going to come on this side, and I'm going to come around as far as I can, and I'm going to just kind of keep working my way around the dressing. Now you can choose to use whatever gauze you like. Now I know you're using the trays in the hospital, so that's 2 2x2s and 2 4x4s, so you may have to bring some additional materials with you. So get hold of this piece. Okay, so I'm kind of moving further out now, so I'm just taking a bigger swath with the cloth. Lift it, try not to touch anything. And you kind of just get the gist of that, so I'm just going to start the dry. I'm just going to dry it. Okay, so I'm going to start at this insertion site, and I'm going to work my way around and just get it out. I'll do one more dry. So basic, same sterile field, same business, same insertion site, just work your way out. I'm going to drop that and wash it and dry it accordingly. So I'm going to leave these on my inside of my sterile field because I'm going to save them. I don't technically need them, but I'm going to keep them there. And what I want to do now is I want to prep the skin. So I want to get ready to put the StatLock device back on, and there is a skin protectant pad there. Now I am not going to use that on the mannequin, or I'll never get this off, but it's just like an alcohol swab. You just apply the skin protectant to clean, dry skin, allow to dry before applying bandage. So you're just basically going to rip that open, and you're going to figure out that you want your StatLock right around here. So you're going to wipe that area with this gauze, this little alcohol-y swab, and let it dry. Okay, I'm just going to set that back down. So at this point then, I am going to take my StatLock device, and I'm going to try to line it up. So if I get it in close enough, I hope you can see. But the channel that it fits into here, it's really kind of hard to see, but it's not right straight. Okay, there's a bit of a, the tube comes down, and then there's a bit of a curve, and then it goes back down. But you essentially want to just put the catheter, follow the catheter, right into the path, okay? And it's going to take some pushing to get it to actually sit into the dark blue part in the center. So this is where you need to be careful that you're not touching something that you shouldn't and be dislodging it because you're not paying attention. So at the insertion site, when it's inserted, typically the physician inserting it will have some type of marking indicated on it where it was inserted. So it might be a little piece of tape, it might be a black marker, but if it's been moved more than 5 centimeters, they need to be notified to see if it's actually still functional tube. So you just want to be really cautious. It's the same kind of idea as the PICC. You don't want to forget about the insertion site of the PICC while you're trying to put the StatLock device on. So I'm going to take the Statlock device, and remember I'm sterile, so I've prepped this part. I want it to lay down flat, so I'm going to take the tube and I'm going with I'm all sterile so I can touch all of this, and I am trying to push it down into once I get it in it'll stay, but it's kind of hard to stay, into the little road there. Once I get it into the channel that it's supposed to sit in, I want to now put the Statlock down. So I'm just going to pull from side to side. Okay, so I'm going to put the first one down, and I'm going to close the Statlock device at this point because I know that I'm good, and I'm just basically putting the Statlock on. So I'm just going to pull from side to side and have this sit, and hopefully it all comes off at once, but this is a little bit older, so there it is. It's sitting. My Statlock device is there. My percutaneous catheter is directly in the channel that it's supposed to be. The clip is clipped. It's been securely fastened. So if it takes a pull down here, it actually gets tugged here so that it doesn't actually pull on the insertion site. At this point then, I would apply my transparent dressing. So the transparent dressing that I'm going to use is not actually the correct one. We don't have the correct ones, but they use an Opsite 3000. And I know in Unit 2, you typically have to call for those. So that might not be an item that's available on your unit, so you may need to call ahead in advance. So now I'm just going to take the transparent, clear, occlusive dressing, and I'm just going to cover the insertion site. So again, this is not the right dressing, but I'm going to cover the insertion site with about 1 inch around the actual insertion site, and I need to cover the Statlock as well, okay? And then I'm just going to work my way around and try to get the air out and remove the strip that's on the outside. Okay, so again, I'll take that side. Sometimes these are hard to get a hold of when you have gloves on. Okay, so that is a percutaneous catheter dressing change. The key to it is read your policy first, gather the supplies that you need, figure out what you're going to remove with blue gloves, set up your supplies, and once you put the steriles on, you're sterile, so that you want to complete the dressing and keep as much sterility as possible. Because this is in a body cavity, we do not want to be careless with it. It can cause the patient more harm than good. So that's the dressing change. Okay, for this part of the video, this is going to deal with the flush. So we're going to say that the dressing change is not due. The dressing is clear, transparent, it's occlusive, it's not lifting, and there's no drainage underneath it. The dressing looks good. So this flush has been ordered every 12 hours, and it's been ordered to have 20 mils of sterile saline. So we're going to just take it in the flush perspective if you were just flushing. So again, I'm going to follow the policy and procedure of Health PEI. So I'm sort of set up here so I can shorten the video, but okay, so I have the patient turned to the side. Again, I'm going to open the system, so therefore I will wear a mask, the nurse, and the patient will wear a mask as well. If they are unable to tolerate it, they have to turn their head away. Again, we are opening the system, so we need to be aseptic. So what I'm going to do is I'm going to pick up, I'm just barehanded at this point, and I'm going to pick up the sterile towel. So I've opened my dressing tray and I've gathered my supplies. So since I'm going to flush it, I need 2 syringes full of sterile saline, so the pre-filled 10 mils, I have 2 of those. And because I'm going to disconnect it, I have to clean the disconnection joint, and I'm going to use 2 chlorhexidine swab sticks for this. Now, some people do use chlorhexidine swabs because they do feel that they get into the nooks and crannies a bit better, but in the policy it calls for swab sticks, so that would be personal preference. And that's really all I need is something to cleanse it with, a sterile dressing tray, because I need the towel and I need sterile gauze, and I'm going to wear sterile gloves as well. So I have those here off to the side. So everything is set up. I'm going to lift up my sterile drape, and I am just going to place it right here. And I'm going to pick up, and I can do that with my bare hands because this is in the bed with the patient anyway, and I can wear blue gloves if I want, but I'm going to place the connection port or the stopcock. So I know you're kind of far away from that, and hopefully I can lift that up so that you can, I'll put it against the green towel. But this little device here is called the stopcock, and I'll make a little section in the video where I can bring that a little bit closer so you can see it. And this is a three-way stopcock. So there's a little lever here that says off, and whatever direction it's pointing is off. So I'll talk my way through it, but then I'll show you a little better visual on the end of the video. So I want to have that connection port on the sterile towel. So I know a lot of times we never use a sterile towel, but this is the time that we're going to use it. So this is a sterile towel. I have that somewhat placed on there. I'm now going to add my supplies. So I'm going to add 2 chlorhexidine swab sticks, and I'm going to prime and prep and prepare 2 10 ml saline sterile syringes with the caps off, and I'm going to add them into my tray just like that, okay, so that they're ready to go. I'm now going to add my sterile gloves. I'll put those on, and then we'll get to the flush. So the flush is a real simple part, but it still requires really good sterile technique. Okay, so I've got my gloves on here, and I'm ready to go, but we never ever touch the tube. Okay, so that's the key. That's why I'm wearing sterile gloves. So I'm going to pick out a couple of 4x4s, and what I'm going to do is I'm going to take my chlorhexidine swabs where I can get at them, and I'm basically going to take the 4x4 gauze and hold the tube. Okay, so remember the tube is dirty, and I want to stay sterile as I can. And I'm going to take this chlorhexidine swab stick, and I'm going to clean the disconnection port of where I'm going to disconnect the tube so that I can actually do the flush. So again, I'm going to take the chlorhexidine swab stick, and we never take off the stopcock. The stopcock always stays with the patient. Okay, so I'm going to go around that, around the disconnection port. And I'm going to discard that one, and I'll do it again. So some people feel that with the gauze that they can get in and get a better clean on this than they can with the stick. So you're going to see variations in practice here, and I think both are safe. That has been cleansed. With chlorhexidine, you know it needs to be able to have the time to dry. So I'm going to wait a second for that to dry. I'm going to take a couple of more sterile 4x4s and just place them on my sterile towel. And I'm going to say that this connection is dry. So what I want to do is turn the stopcock. I want to turn this here. Remember, don't touch anything. I'm going to take a gauze, and I'm going to turn the stopcock off. And I'm going to turn it towards the patient. So you'll eventually be able to see that. But that is pointing towards the patient. I want the system to be off to him right now. And I have 2 other ports, but that doesn't matter. They're open. That doesn't matter. I'm going to disconnect those, okay? So it's off to the patient, and I'm going to just set my gauze. I can set it wherever. I'll use it probably again. Now I'm going to disconnect this one. The key is just remember, don't ever touch the tube. It's just you got to think of it like a hot potato. You just don't ever touch it. So using the gauze, you're going to take off the tubing. So I'm kind of moving my hand down so that you can see where I disconnected the tubing, okay? So I'm kind of up against white stuff here. It's hard to see. And I'm going to set that tubing on sterile gauze. That's why I have it setting right on my sterile field, because I don't want anything to touch that end. And this can be garbage. I've got lots of sterile stuff in there that I can reach and grab. I'm going to reach up and grab my saline. I'm going to put it into the port. I'm now going to open up the highway. Okay, so get the off away from it so that the highway is kind of open. And then I would flush the patient. Now, obviously, this is a mannequin, and I'm not going to flush it, but I would, gently kind of push, pause, push, pause, push, pause, till I got the whole 10 in. This patient is ordered to have 20, so I want to push that in. If the patient feels any pressure or any pain, you need to stop. But technically, this is going, it's kind of like it's like rinsing the dishes. There's a pocket of pus or a pocket of fluid we're trying to get out of there. So this is just putting it in and just kind of washing it in on the inside. So once I have that whole 10 put in, I'm going to turn the stopcock off, right, because to the patient has to be off. And I'm going to take off, hang on to the stopcock. This has been inserted, so this one's gone. I pick up this guy, pop it on, open the stopcock, hold the tube, push pause, push pause, push pause, so a 20 ml flush. Now you might be ordered to kind of flush and aspirate. So if you are, just watch what your order says. If it's flush, just put it in. If it's flush and aspirate 20, you flush, put in 20 and try to get 20 back out. So just follow your doctor's order for that. So that goes in. Before I take this off, I need to close the stopcock. This has been inserted, so this is no good. And now I need to reach back and grab my gauze that has been sitting up here on a sterile gauze, grab the tubing that's been sitting on a sterile gauze, and it gets put back together. Screw it on tight. Make sure your connections are tight, and then turn your stopcock to the on position so that the fluid, which means that the fluid is not going to come out this hole, it's going to come in here and go through here so that your highway kind of is clear and it will drain into the bag. So it's not a huge procedure, a flush, but it does require strict sterile technique. Where students tend to get all mixed up is they don't know what to touch and what not to touch. And my way of encouraging students is just do it all, but don't ever touch the tube. Always try to hold it with sterile gauze. You know, you're going to see a lot of variations in practice in this. So just have your sterile tray. Just pick up the gauze. It's super easy. Just have a piece of gauze to pick it up. And just anytime you touch the stopcock or anytime you touch anything, you're doing it with sterile gauze. And that's the flush portion of a percutaneous drain. Okay, everyone, this part of the video will deal with just the bag change. It is possible that we would just change the bag and tubing without actually changing the dressing. So again, remember, the dressing is 7 days, every 7 days, unless there's drainage underneath it. It's not occlusive, it's lifting, it's not intact. Or it looks like it needs to be changed. That's nursing judgment. We're going to change that, but otherwise every 7 days. Bag and tubing is changed every 3 days. So you want to see these tasks. They should fire on your checklist, on your Cerner task list. So in order to do the bag change, you don't have to physically use sterile gloves. We're just going to use non-sterile. So again, we're going to do all the correct things. We're going to find the right bag, the right tubing, and connect those. You get those off the policy, or it might be indicated in the patient's chart. And you're going to just identify the patient, gather your supplies, do all that business. And then we're going to do everything essentially the same, but we're just going to remove this portion. So I'm going to show you, I'll lift it up a little closer where you can see it, but this is the bag and this is the connecting tubing. So it comes together in a package, but it is not put together. So it looks like this. The bag looks like so, and the tubing is not connected. So basically when you open it, you're just going to have to add the connecting. And it tells you this is the top arrow, and the bottom. So it drains from here, and the top is where it's going to connect to the patient. So you would need to assemble this part first, okay? I don't have a second bag to show you, so that's kind of my problem here. So I'm going to use blue gloves, and again, we're opening the system so the patient can turn his head away. We're going to deal with the stopcock, but I don't need to use sterile gloves. Now, why? We can discuss that all day long, because we essentially are opening the system again to the patient the same as we were doing with the flush, but this does not require sterile gloves. So for you guys starting, you might want to have a nice sterile towel to set it in. People that have better dexterity with more experience may not. There will be some variations of practice, but you just need to go slow and be sure of what you're keeping sterile. So over to the side, I would have assembled the bag and assembled the tubing. So what I want to do is disconnect the old and assemble and attach the new. So it's the same principles as before, but I don't have to use all the sterile of the touching when it's open. So I can lift this, I can turn this to the off position because this is where it needs to be. Anytime I manipulate it, it needs to be in the off position. And I'm going to chlorhexidine swab the connection site where I'm going to disconnect from. Okay, so I want to disconnect. I want to cleanse all of that, and I'm going to throw that one away. And then I'm going to grab a second one and I'm going to do it again. So I'm going to clean those all in around the disconnection port site. Okay, we know the drill with chlorhexidine, it has to be allowed to dry. So I need to let that dry. When that dries, I need to ensure that I'm turned off to the patient. I can then leave the stat lock on. I'm going to remove this bag, okay? So this bag and connector tubing, okay, see this? This part's all garbage, so I would throw this away. That has to go in biohazard because it's bodily fluids. And I would have assembled beside me a new bag and a port that needs to be kept sterile. So you might want to have it on a sterile, have your dressing tray open and sterile until you figure this part out. And then you're just going to basically pick it up and put it on and screw it tight. And then open, so that it drains from the patient, open your stopcock to your patient. Okay? See that? So I'll see if I can zoom this in a smidge. Maybe not. I'll try to pick it up here a little bit closer. I just want to show you the stopcock. So when it's inserted with the patient, there is a kind of a funky device here, and it's called a stopcock. Now, if it was a two-way stopcock, this third port, this one here, this third port wouldn't be here. But that's okay, just ignore it. You're not using it anyway, it's turned off. So that means that the highway, basically for fluid to drain, is open. So, and it has red letters there, off. So anytime I want to open the system to the patient, to flush it, to do anything, I want to turn it off, okay? So I want to turn that off to the patient, so it says off, off to the patient, and therefore I can do whatever I need to do. So anytime I manipulate or use a stopcock, I always put my fingers right on the stopcock, because therefore it allows me to take off the right device without removing the stopcock. In the package, when you go to do some of the changes, a new stopcock will be there, but we don't use it. We always leave the original stopcock on to the patient, okay? So leave that one on and just ignore the new one that came, and then you're always going to hang on to your stopcock and make sure that it's on or off. So we'll be with you just so that you kind of, it's a lot of, you know, patting your head, rubbing your tummy kind of thing. It's a little confusing at first, but it's quite a simple process once you get going with it, okay? So that is just, hopefully you can see the stopcock there good enough. So I have opened it to my patient. It is now able to free flow into the patient's bag, which I'm going to empty at the end of my shift and record in the ins and outs. There's little slits here that would be used, you know, to put around his leg, but typically we'll use a safety pin, and we'll just take a safety pin and safety pin it to the shirt so that the weight of the bag does not pull from the tubing, okay? And that's care of a percutaneous drain in a variety of locations.